Hello everyone. So, are you able to hear me? You know, I just straight away put a question. Just we move it and see that if you have joined. It's not to see a few comments and then we will start. Okay, just wait for another 4-5 minutes. Are you able to hear me? Is my voice audible? Is my voice audible? And a couple of you just write and we will start. We actually have started coming regularly live on YouTube. It's quite some time because we are using the technology to reach out to students who find it difficult to come in the classroom, right? And thing is, lot of students are connected to us via our e-medicos app. But this is basically just a way to interact with the students on YouTube also, so that few students who have doubt in plus minus at what we are teaching, so let them see our way also of teaching, and let us provide some information which is not provided to them by other means. So this is basically the August is gone. We have September, October, November, December are confirmed. You have 4 months 100%. Your exam might be in Feb also. They might come in Feb end or March first week or mid-March. But we have to be prepared like your exam is in December end or Jan first week. Because the counseling is still going. In fact, the counseling has started, and the state counseling is there. Then again, second round will be there. Then again, second round of state will be there. So it will go on for another 1.5 months. Then you will have army interviews, and then you will see students joining colleges. Then you have the management seats or private quota seats and all that. So basically, I am expecting your exam to be in Feb, mid or March, like this year. But we have to be prepared like the exam is in December. Okay. I have made a few questions. A few have been twisted. A few are newly made, and which I expect the question to be asked in exam. Before that, I will just tell you a brief thing about DAMS. We are providing since 10 years dental coaching, and we are consistently providing good results from classroom students, from regular batch students. At present, the major way of connection between us and the students is e-medicos app. You can just download that also, E-M-E-D-I-C-O-Z. If you are not our student, you can just download the app. You can opt for any course. There is a free trial also. At present, we are providing everything that is from past question papers to regular classes, live classes, recorded classes, question banks, previous MO papers, previous essayship papers. Everything is being provided live to you. Everything is there in your app, right? Students who want to attend the classes, but it is difficult. If they find it difficult to come to the classroom, then they can attend the class on app. It is there by live also, and if you miss a few of the class, then you can attend the recording also. We have activated the WhatsApp groups for doubt solving also, because previously we were not using WhatsApp to solve the doubts. Now we are providing the answers on WhatsApp also. So there is not even a single thing of technology which can be used in a constructive way and we are not using it. Though I agree that WhatsApp has some limitations like number and all that, but now we all expect that you all are mature enough to use it judiciously, right? So that is the first information that you have. First information was that exam expectation, when can it happen. Second thing is what we are providing and all that. Third thing is the most important thing at present. Like we all feel that okay, 4 months we have. So the next 4 to 5 months, or even 5.5 or 6 months, please keep a positive mindset. Positive mindset means negativity se dur rehna hai, right? Elections are coming, so many negative things might come. Please avoid it, right? There is no Hindu-Muslim in your entrance examination in a healthcare. Please avoid it. 100%, not even 100%, 200% of focus should be on exam. Any sort of negative news, negative people, negative surroundings should be avoided. कोई नहीं बोलेगा आपको, मैं बता रहा हूँ. You have to avoid it, right? Be it your close friend also, teachers, professors, whatever system you are into. If there is anything negative, please वहां से just escape, right? Okay, fourth thing, please maintain a regular diet and a proper sleep. Don't ignore it. A mini mistake in diet may trouble your preparation for 4-5 days, right? So next 6 months, it is not just about your focus onto your books also, or your notes also, or your classes also, or your notes also. You have to avoid these negative stuff also, right? The next part is keep on revising. एक आप schedule बनाइए. The students which we have, I have given a schedule also, how you have to prepare and all that, if you are starting from after 3-4 days and all that. And maintain a schedule of revision, like X subject, if you find it difficult, revise it very soon. If Y subject you find it very easy, then revise it a bit later as compared to the X subject. So revision, and it involves revising the notes also, as well as doing the MCQs also. In the initial stages, you can read the whole notes again. In the gradual stages, as the time passes, you may just read the marked points and the marked MCQs. Last May, the condition should be like that. In the end, you should forget that how many times you have revised, how many times you have solved the MCQs. है ना? You must lose the count. That much should be the focus, right? So these are the basic stuff which our students or any student ignore, right? You have studied the same books, same notes, same MCQs as any student. The only difference between a ranker and a non-ranker will be how consistent, how holistically, how focused they were in their studies, and how good they have avoided the negative things from their life. ठीक है, ये एक बहुत बेसिक चीज थी. दिस इज अ वेरी बेसिक स्टफ विच मैनी हार्ड वर्किंग स्टूडेंट्स अवॉइड टू नोटिस, स्पेशली द इंटर्न्स. आप नए हो, है ना? व्हेन वी वर प्रिपेयरिंग, people who were preparing from 2 years, 3 or 4 years, they were known as khiladi. But now the maximum students are selected who are freshers, right? Be it a private college, be it a GDC. So you have to keep a focus on these minor things, है ना? Especially the students who are new, right? और freshers के ही selection के chances ज़्यादा होते हैं, right? So I have made some questions. We will discuss them one by one, right? If you have to ask anything, you can just write it down. Else we'll start. Right? I have made 10-12 questions for you, and we'll try to cover it. I know it is 9 to 10, but I might cross a little bit more if we are short in that. Okay. So this is the first question. Current exams, many questions are being asked in ortho and pedo. I request you to at least be thorough with your pedo. It is the most difficult subject to practice if you don't love pedo, right? If you don't love pedo, it is not actually the most difficult, but difficult if you don't love pedo. You have to be in love with pedo, only then you can do a good pedo, right? Lot and lot of stuff are being asked from new things, and I guess the current you can say that Kranti or something which is new has happened in past 4-5 years is a rapid growth of using laughing gas or nitrous gas in the practice. Enough. I give you my example. I do all my 100% cases in nitrous. Or if it is not in nitrous, then it will be in midazolam. Right? So many examiners are now asking questions from that, and I expect that 1 or 2 questions will be 100%. They will be from sedation. So the first question is, I just have kept this hood also. Right? If you can see, this is how we place the hood, and there are 2 pipes which are connected to the machine, and we ask the patients to breathe from the nose. This is from where that we apply some machine here also, from which the gases will come. One will be exhaust and all that. So it is basically covered like this, right? We ask the patient to breathe, deep breathing, right? And then we gradually increase the level of nitrous and reduce the level of oxygen. So that is how the machine functions. That we'll discuss at some later point. One day I will take a machine session only. So the question here is, machines which are set to deliver 70% nitrous oxide delivers approximately how much percent of nitrous oxide to the patient's alveoli? The question means, question से पहले जो nitrous की the machine which we use has a system of 30-70, that the maximum amount of nitrous which you can give is 70, and the minimum amount of oxygen which must be there, that is 30, right? Oxygen can go from 100 to 30% oxygen, whereas nitrous can go from nitrous can go from 0 to 70%. One more new question, that what can be the range of oxygen? That is 100 to 30%. The machine will be giving at least minimum 30%, whatever be the case, otherwise the machine won't work. That is known as fail-safe mechanism. And the second is, nitrous can be given from 0% to maximum 70%. In no case machine is going to give the patient 100% nitrous oxide. Got my point? So this is the one new question. Now in the question what they are asking is that what is the percentage of nitrous oxide which can be given to the alveoli, right? तो एक बात याद रखना, इस बात को समझ के रखना, पहली चीज कि whatever nitrous oxide the patient is taking, if machine is showing that it is 70%, like he is breathing, there must be some leakage. There must be some leakage. How snugly, how good you have fit this hood, there will be little bit of leakage from here. There will be little bit of leakage from the pipelines. And there will be little bit of leakage from the air with the child is breathing. Uska muh, his mouth will be open for a limited time. Kuch na kuch baat karega. He will be communicating with you. He will be talking with you. So there are some conditions which the machine is showing it is 70%. It is not 70%. So in the question they are asking, it is 70%. Then what will be the nitrous reaching the alveoli? So can you guess what will be the answer? If the machine is showing 70% nitrous and 30% oxygen we are giving, that is a maximum level. So how much is actual nitrous oxide reaching the alveoli where there is a gaseous exchange? Can you guess? Machine is showing 70%. How much nitrous is actually interacting with the... Okay, so your options are 10 to 20%, 20 to 40, 30 to 50 or 50 to 60. Any guess? Only one student has said reply. This basically it goes via this, from machine to mask to pharynx to blood. This is from machine it is going, and it, when the level of interaction comes, it is like this, right? It is keep on diluting and it provides. Okay, the good thing is you have answered, and most students are close to the answer. That is, it is approximately 30 to 50%, right? The remaining will be leaked via from mask to pharynx. It goes like this. So the answer is option C. The answer is option C, 30 to 50%, right? And trust me, it can be asked. It can be asked. Itna loss hota hai, right? When I have started using nitrous first time, so I was little bit scared. It was not scared, it was little bit of anxiety was there कि क्या हो जाएगा, right? And as gradually as you use it, you will realize that if you, and see, I will tell you, because someday if you take a pedo branch or you do pedo practice, or if you find machine usable for the adult patient also, because we apply on adult patient also, this is the best thing which has happened to pediatric dentistry. And even if you want, आप चाहोगे, even then you can't kill a patient from this machine. Leave apart killing, you can't make the kid unconscious also. That much safe is the machine. The only thing is how to use it, and that can only be learned via regular using. When you have first made the class 1 cavity, it was not ideal. Now you can make an ideal cavity. So everything is like this. कोई भी सीख के नहीं आता है, सीखने आता है, और सीख के सिखाता है. Got my point? So the answer is 30 to 50%. Right? The next question. The window of infectivity for the acquisition of MS. What is MS? Mutans Streptococcus mutans. Mutans Streptococcus. Now what many students will do is they will straight away answer एक रटा रटाया question, रटा रटाया answer, what they have mugged of 19 to 31 months. See, what is window of infectivity? Can you tell? What is the meaning of window of infectivity? What is window of infectivity? Window of infectivity. What is window of infectivity? It is the time when the patient child is most likely to acquire MS, Streptococcus mutans, or you can say, or karyogenic organisms, window of infectivity. And the question they have asked you about second window of infectivity. That means there are two window of infectivity. Anuradha, it is like the age at which the child is most likely to acquire the Streptococcus mutans. Some books write MS, some books write SM. Okay, so it happens not once but twice, right? There was a scientist, one second, Caulfield et al. They have given the window of infectivity. They have given window of infectivity, which was the first window of infectivity, which was 19 to 31 months. 19 to 31 months. And there were other people who were Krass and Ederman. Now in Krass has been told as 1967 and Ederman at 1975. They have proposed a second window of infectivity, and according to them it coincides with permanent teeth eruption. So the first window of infectivity was this, and according to Krass and Ederman, the second window of infectivity is, any guess? So make sure you have read the question. It is not asking about the first window of infectivity, it is asking about the second window of infectivity, which was given by Krass and Ederman. Many books have just given the name Krass, Krass. Some have written Krass et al. But basically two scientists were there, and they have said that the second window of infectivity is around 6 to 12 years. Good. It is 6 to 12 years. Yeah? So this question was just to make you aware that how important it is to read the question with the patience. है ना? Maximum books has given question, एक पुराना question है, the window of infectivity for the MS is, ठीक है? Question में straight forward यही है. Window of infectivity, many students blindly they will write 1931. Window of infectivity 1931. अरे भाई, please read the question. They are asking about the second window of infectivity. And suppose if they have just asked window of infectivity, है ना, there is a way to answer the MCQ also. Suppose in question they have just asked, ये हटा दिया, they have just asked window of infectivity, then what you will mark? Then it will be first, right? Then it will be first. Or there is a possibility that they asked you window of infectivity and the options will be 1 to 3 year, 3 to 6 year, 6 to 12 year, 12 to 18 year. Then what will be the answer? 6 to 12 year. So always mark the answer which is closest or which directly or indirectly is pointing towards the answer. Please make sure that you are not in a hurry to answer the MCQ. है ना. You should not be in a hurry to answer the MCQ. क्वेश्चन आंसर करने से ज्यादा इंपॉर्टेंट क्वेश्चन को पढ़ के आंसर करने में होता है ना. एंड you have 240 MCQs in exam, you have 180 minutes. So basically you will have approximately 40 to 45 seconds to answer. And that can only be speed up if you practice the test and MCQs now. Many students are just reading notes and not practicing MCQs. And some are just practicing MCQs in guidebooks but they are not giving test and see where they are doing wrong. So both the ways are wrong. Test though, do analysis, what topics you are making more mistakes, read them, do those MCQs again and then you proceed. तो यही जब कर पाओगे then only you will be able to understand the concept of 40 seconds for one answer. In exam you will see 100 questions you will be answering within 10-15 seconds. But few require 4-5 minutes of logical thinking also. And that can only be, the time can only be you have in your hand when you start practicing now. तो अगर टेस्ट नहीं दिए तो टेस्ट दो. You will have so many talkative tests, grand tests and all that. Please give those tests. Right? Next question. The distal step relation in 5-year-old with no premade space will most likely result in. Any guess? No primate space. Distal step. What is the terminal plane? What do you mean by terminal plane? Upper, lower. This is the distal part of the E, right? This is the end-on relation. You can say this is E, this is upper E. So whenever the upper E is behind and the lower E is forward, what will be this relation? Mesial step. When the lower E is behind the upper E, the distal plane, that will be mesial step. Sorry, distal step. Got it? ये चीज समझ में है आपको? When the lower E is more forward, mesial step, lower E is behind, this is class 2, right? So whenever there is, in the MCQ they have asked you, whenever there is no primate space, what will be the result? The question is telling you the answer. The question is telling you the answer, right? But before that, I will just tell you a few more important things about that, right? A distal step will always end in class 2. A mesial step will most likely end in class 1, and in few cases it can go into class 3, whereas a flush plane may go into class 1, 2, 3 or remain end on. So the end result of distal step is always class 2, mesial class 1, few cases class 3, and flush plane 1, 2, 3 or end on. Right? This is the first point. And the second point is, which is very controversial also, but trust me, the question will be from McDonald's, and the most common step in a primary dentition is mesial step. The study shows that almost 50% of cases will have class 1 relation and then flush and then class 3, right? In the beginning of mixed dentition, the most common relation is end-on, and at the age of 12 years plus, the most common relation is class 1, which is quite approximately 60% of cases. This is not according to me, this is according to McDonald's, right? From 5th edition to latest edition, 11th, it is going on, right? So the most common primary relation is mesial step. It is given wrong in many books like flush and all that. In primary, it is mesial step. In the beginning of mix, or just if they ask you just the mixed dentition, it is end-on, and plus 12 years of age, it is class 1. The most common, बता रहा हूँ, okay? So that is the two important things apart from this question. That will be distal step will most likely will go into class 2. Primate ho na ho, as per McDonald's graphical representation, it's like this only. So just remember that the distal step will end in class 2, and it can be asked as an MCQ. Okay, समझ में आया कुछ? वैसे इसमें समझने का नहीं, इसमें याद करने की चीज है, right? Next question. SDF, a very hot thing going on in pediatric dentistry. SDF, super hot. The minimum application time of SDF, silver diamond fluoride, कहाँ use करते हैं? Where do we use SDF? Can anyone tell? Where do we use SDF? It is, see, we use it frequently in cases and which must have at least two criteria. First, you should be sure that there is no pulp involvement. You should be sure. First thing. The second thing is very simple, the child is not cooperative. The child is not cooperative for drill or even chemomechanical caries removal. क्योंकि उसमें what you have to do in the chemomechanical caries, you have to use a solution, you have to apply it as a gel form like carizole, and you have to keep on rubbing for 10-15 minutes. बच्चा नहीं बैठेगा चेयर पे, the child will not sit onto the dental chair. Every week, 1 to 2 cases they will come like this. And it is not just like under 2 year of kid, it can be in under 5, under 3, under 8, under 7 who is scared to shit. That type of patient, but you are sure that the pulp is not involved, you can use silver diamond fluoride which will arrest the caries. The only drawback is it makes the tooth black. Right? The only drawback is it is very anesthetic, highly anesthetic, but it is very effective. So if that social torture or that thing is, if patients, the parents can ignore and the kid can ignore, the kid will always ignore and the parents can ignore, then it is fine. We use it, right? And later when the child gains some cooperation, we can just drill it and remove it. So what they have suggested, what is the minimum application time? See, now there is a controversy. According to McDonald's, they have suggested an application time of, they have used some particular term. They have used some particular term that it should be applied for at least 2 to 3 minutes. Right? 2 to 3 minutes if possible. This is according to McDonald. Whereas the AAPD, the American Academy of Pediatric Dentistry, which we follow, क्योंकि हम इंडिया में तो हम कुछ फॉलो करते नहीं है, we follow only AAPD. हम तब फॉलो करेंगे जब हमारे यहाँ पे कुछ होगा, हम तो कॉपी करते हैं पीडियाट्रिक डेंटिस्ट्री में, ठीक है। ये मेरा ओपन कमेंट है यूट्यूब पे, मुझे पता है इट माइट हर्ट फ्यू पीपल, बट वी आर इन पीडो वी मोस्टली कॉपी, है ना। सो व्हाट APD सेज दैट द मिनिमम टाइम शुड बी एट लीस्ट 60 seconds, which is the answer, है ना, which is the answer, 60 seconds, right? Apart from that, I will tell you a few important things about SDF also. It provides 44,000 ppm it provides 44,000 ppm of fluoride. One second. I guess there is some problem with the pen. It provides 44,000 ppm of fluoride. Right. And it has a pH of, can anyone guess what is the pH of SDF? 44,000 ppm of fluoride. It has a pH of, can anyone guess what is the pH of SDF? It is very alkaline. It can be asked in MCQ also. What is the pH of SDF? 10. It has a pH of 10. And according to McDonald's, no more than 5 teeth should be treated. No more than. You should not treat more than 5 teeth, right? You just have to take a drop. Apply it onto the tooth and keep on rubbing for at least 60 seconds, right? So this is what the AAPD recommends. Sometimes we just apply for 10-15 seconds also. Sometimes when the child is very uncooperative and all that, but it is our full intention to apply it, keep on applying it for at least 1 minute, right? And we take a follow-up later. Sometimes it needs reapplication after every 6 months also, till the child gains the level of cooperation. Okay? Rest SDF, many questions in your test. Next question. In a 4 to 8 year old child, fear of dentistry is due to all factors except. Any guess? Any guess? Muskan said D. चार से 8 साल के बच्चे में it can be anxiety also, it can be fear, it can be long standing subjective fear also. But the separation anxiety is basically commonly seen at the age of 2, though it is not age defined, है ना? Sometimes it has been wrongly given that it is age defined. The separation anxiety is many books have said that the terrible 2 term you must have heard, na? So that is basically not a correct term, but the separation from parents is basically seen at the age of around 2. It is more what we say, it is more close to the development of the kid as compared to the age of the kid, but still it is close to that age only where the fear of anything is because of separation from the parents. Up 6 months, 1 year kid को आप गोद में उठाओगे, he will not cry. But when you take a kid who is close to 2 years, है ना, and from away from his parents, the child will be very anxious. He has fear. So that is mainly because of this. So that the answer will be separation from parents. Next question. Next question. Any guess? As shown below is the type of, what type of fixation is this? You may see such cases after dental trauma. Previously, when I was in UG, I guess 20 years back, we used to see such cases. After avulsion, they used to reimplant and they do like this type of fixation. We don't do such type of fixation now, because this is basically a type of fixation which don't allow the tooth to move, and it is a very wrong way, because ultimately after avulsion, if you apply such type of arch bars, these are basically arch bars, right? These are basically arch bars, which is now contraindicated. Right? So it is a way of rigid fixation which is incorrect. It is not, Mohammad Hussain, it is not a correct way, it is an incorrect way of fixation. Right? After avulsion, if you apply this, after avulsion, see, you might see such type of half written questions also in exam. The language is not properly made. I have lifted this question from some source where they have said that the question was like this only in the exam. So if you see such type of MCQ, you have to apply a logic that this is the wrong way. This is not IMF. It is not IMF. Otherwise, you would have seen that the lower is applied and all that. This is basically a avulsion case, and you have stabilized it via splinting. It is a way of rigid splinting, which is wrong. The current concept is very simple. The splint is given. If you see that, if simple 16 of बताऊं, if you see any question in exam that the tooth is avulsed and you have to reimplant it, you have to splint it, and they have not given you any option, then the simple thing is the current time. In the current time, the splinting is done for 7 to 14 days. If there is no properly detailed data is given that the tooth is avulsed after 1 hour is there, within 10 minutes the tooth is there, with the physiological media is there or no there, just remember that 7 to 14 days the normal time was splinting, right? And you have to go with a semi-rigid splinting. You can say it is semi-rigid or you can say it is flexible, same thing. Rigid splinting, non-flexible splinting we don't use, right? It is contraindicated. I have told in some test also is given detail that what CAMP has basically given the criteria of what type of splinting the splint should have. It should allow normal mobility, easy to clean, easy to remove, easy to apply. It should allow normal physiological tooth movement. All these things, it should be cheaper, and all those things are given by CAMP, right? So we don't apply a rigid fixation now. Common stuff in a new practice, in a new private practice, or commonly especially seen in your first year PG. Seventh question. क्या होता है, commonly we see such cases. What happens? Any root canal is done, especially lower molars. In the initial stage, we apply block. That is rule of 10. If the age and the tooth number is more than 10, then we have to go for block. If the age and number is less than 10, then we have to go for an infiltration. But generally, we prefer giving a block, a lower molar, if the child is a little bit cooperative. So once that area is anesthetized, the child goes for root canal treatment. We do the root canal, we give the cap. आधा एक घंटा डेढ़ घंटा, it takes around 90 minutes, 1 hour to 90 minutes if you are fresher, right? Sometimes it takes 2 hours also in the fresher. After that point of tiredness, sometimes you forget to give proper instruction. The simple instruction is, we have anesthetized the area, next 2 hours it will be like this only, so the kid should not bite like this. We tell this to the kid also, and we tell the parents that for the next 2 hours, the patient, the kid should be in front of you. Otherwise, the child might bite because the area is anesthetized. He might feel there is a balloon and all that, which actually is a wrong thing with the child. Senses like that there is a balloon, and ultimately try to punch it and pressure it, and ultimately after 4 to 10 hours, 12 hours, one day you will see that there is an area ulcer, right? And apart from this, the new thing which is in the market is, Oraverse. Can anyone tell me what is Oraverse? Oraverse is given by now the company Septodont or Septodent have introduced this. It basically reverses the effect of local anesthesia. Oraverse. Now what is that? It is phentolamine mesylate. It reverses the effect of phentolamine mesylate. Okay, you can use it. थोड़ा महंगा आता है, ठीक है, कितना आता है मुझे नहीं पता, महंगा है तभी तो हमारे पास है नहीं, मतलब हमारे इंडिया में कॉमनली अवेलेबल नहीं है, right? And it was an MCQ also. Oraverse by Septodont. It contains phentolamine mesylate, right? So this is basically lip biting because of anesthesia. Good, Anjali. It was asked by some student also some days back. Midazolam. I use it very frequently. If someone has seen a person who is totally drunk and how he walks and all that, this is what midazolam can do. है ना, इसका मतलब ये नहीं कि आप लोग स्टार्ट कर दो, ठीक है, कुछ चीजें बताता हूं, आंसर हम डिस्कस कर लेंगे, ठीक है, कुछ चीजें बताओ मिडाजोलम की. द ऑनसेट हैपन्स ऑफ मिडाजोलम. मिडाजोलम के इंस्ट्रक्शंस आर सेम लाइक नाइट्रस ऑक्साइड. बिफोर यूजिंग नाइट्रस ऑक्साइड वी टेल द पेरेंट्स थोड़ा एम्प्टी स्टमक होना चाहिए, नॉट शुड हैव ईटन सो मच एंड ऑल दैट बिकॉज द चाइल्ड कैन वॉमिट एंड ऑल दैट. लगभग सिमिलर इंस्ट्रक्शंस वी गिव, राइट, एलर्जी एंड ऑल दैट. नाउ व्हाट इज द ऑनसेट ऑफ मिडाजोलम आफ्टर गिविंग द डोज मिडाजोलम? The onset of midazolam occurs within 20 to 30 minutes and the working time is 30 minutes. ये दो MCQs हैं, right? Half life is 1 to 4 hours. It is basically a replacement of diazepam, right? The cognitive function है ना, दारू पीने के बाद जो असर होता है बेसिकली लाइक मिडाजोलम, द कॉग्निटिव फंक्शन कितनी टाइम में वो नॉर्मल तरीके से उसके जो कॉग्निटिव मेंटल फंक्शन काम करना स्टार्ट करेंगे इज विद इन 4 hours. within 4 hours, right? Its dosage is 0.25 to 1.0 milligram per kg for oral route, right? For intramuscular route, it is 0.1 to 0.15 मिलीग्राम पर केजी. भाई हम तो ये यूज करते हैं कॉमनली, ठीक है ना. IV फॉर टाइट्रेशन, डिपेंड से कितना उसमें काम कर रहा है. एंड फॉर नेजल यू कैन गिव वाया नेजल रूट एंड द डोजेज इज 0.2 मिलीग्राम पर केजी बॉडी वेट. 0.2 milligram per kg. 0.2 milligram per kg. So oral, IV, IM, nasal we give. It is not given in a vapor form. It is not given in a vapor form. The answer is inhalational. Got it? The answer is inhalational. So basically what I am trying to do is I am trying to make a question. I am trying to get an answer from you and I am trying to provide you 2-3 additional MCQs which can be asked. ठीक है. और ये सब चीजें कमिंग INA, CET एंड नीट के लिए इंपॉर्टेंट है. कुछ के ऊपर क्वेश्चन डायरेक्टली आ चुका है और कुछ पे दे माइट ट्विस्ट एंड आस्क द MCQ. राइट? गॉट इट? सो इट इज नॉट एडमिनिस्टर्ड वाया इनहेलेशनल रूट. Next question. Next question. Next question. Any guess? A 6.5-year highly uncooperative boy with a treatable grossly decayed 8485, right? With a proximal caries but not involved in the pulp after all diagnostic aids are tried, best treatment will be. So this is a straightforward question which has been made a complicated one, right? Basically, it is saying that the tooth is treatable, there is no pulp involvement, there is proximal caries. Right? What the examiner is asking the question. It has gross caries means occlusal must be there, and they have said that there is proximal caries also. So that is a multi-surface caries. So multi-surface caries में you can't use GIC. Right? You can't use composite because the child is uncooperative. Can you use amalgam? No. What will be the answer? Whole crown. What is whole crown? Whole crown was actually the crown which is given without LA, without tooth preparation, and without caries removal. You have just given the crown. You have just given the crown. So this basically is showing you, this question basically is showing you that it is not how good you are in just rectifying and answering. You need to understand what the examiner is asking. है ना? वो एक थी ना, there was a movie Chak De India, right? You have to hit the mind of the goalkeeper. Similarly, you have to see that what the examiner is asking. What does he want as an answer? So there is a proximal caries, right? Gross means there must be occlusal caries because the tooth number is 8485, right? Pulp is not involved. The kid is uncooperative. In uncooperative, composite use नहीं होगा. Multi-surface, you have to give crown. And what is the crown? Hall crown. Right? अनकोऑपरेटिव है. अब ये मत बोलना कि सर सिडेशन यूज कर लो, नाइट्रस ऑक्साइड यूज कर लो. वो अपने पास यहाँ पे ऑप्शन में नहीं है. नाइट्रस ऑक्साइड की मशीन बहुत महंगी आती है, स्टार्टिंग में हर एक कोई नहीं खरीद सकता. इट इज नॉट, है ना, इट इज नॉट लाइक 200 रुपी kg टमाटो विच यू कैन बाय, राइट? आई गेस टोमेटो आर नॉट चीपर नाउ, आई गेस. ओके, so the answer will be whole crown. Okay, next question, right? Next question. An 8-year-old kid got a complicated crown fracture in 1-1 and there is a large pulp exposure while playing football. Now less than 23 hours have elapsed, the pulp is exposed and the treatment advice will be. Right? Again the question is twisted, intentionally twisted. There is no relevance of 23 hours. See, there is a no clear term which shows what is acute and what is chronic. Acute means 1000. If there is a comparison of 1000 years with 1 year, then 1 year is acute. If you compare 1 hour with 3 hours, it is, है ना? So the difference, 1 day in a 1 year, very far, right? 11 months in 12 months, very near. So there is no clear-cut description between acute and chronic. किससे compare किया गया, right? And in the question they are asking that 23 hours, less than 23. It can be 1 hour also. It can be 2 hours. It can be 22 and a half hours. So that is basically asking you that the case is of recent. It is an acute case, right? 8-year kid, the root must not be complete. The root must not be complete. And in the picture you can see that there is a bleeding point. That is, the pulp is exposed and the structure is quite lost. So what we have to do is, you have to, if this is the tooth, if this is lost, what we have to do, you have to create additional space. You have to remove this much of pulp, apply some MTA, right? And the root which is this much incomplete, because the apex is incomplete in an 8-year-old kid, you apply some material here which allows the tooth to get the root naturally completed, right? So this is basically asking you about spheric pulpotomy, right? Right? Now this is also right. It is apexogenesis also, it is spheric pulpotomy also. It is apexogenesis also, it is spheric pulpotomy also, right? What will be the answer? Both are right, and I'm sure that in the key also both will be right, but you have to suppose, if you have to choose anyone, the examiner is basically asking you what is the procedure which you are going to do. What is the, basically what do you want? You want, first is always apexogenesis or apexification, then you have to go with the what we are doing, right? And here apexogenesis and spheric both are right. This will be the preferred choice, because we are doing apexogenesis via spheric pulpotomy. We are doing apexogenesis via spheric pulpotomy, right? And suppose here in the question, if they have said this not 8, if they have given the age of the kid as 12 years and it is saying that it is more than 23 hours, what will you do? Now this is straight away a question of pulp is gone. After 23 hours, that means the pulp is gone. and you have to do a root canal treatment. तो क्वेश्चन की लैंग्वेज के हिसाब से योर आंसर विल कम. व्हाट इज द लैंग्वेज ऑफ द क्वेश्चन दैट विल गाइड यू टुवर्ड्स द आंसर ऑफ द क्वेश्चन. दिस इज क्वाइट नियर ऑप्शंस, है ना. यू मे नॉट सी सच टाइप ऑफ नियर ऑप्शंस इन एग्जाम, बिकॉज फॉर दैट ऑल्सो द एग्जामिनर मस्ट ऑल्सो हैव, है ना. यू गॉट माई पॉइंट, राइट. तो हम वही चाहते हैं कि डिफरेंस बिटवीन एपेक्स, ओके आई विल टेल यू. हम वही चाहते हैं कि जहां एग्जामिनर का दिमाग पहुंचे हम उससे एक कदम आगे रहें तो बेटर है. अब तो हम चांद पे ही पहुंच चुके हैं, राइट. एक्चुअली सी एपेक्सोजेनेसिस इज बेसिकली, आई विल शो यू टू केसेस, ओके. ऑन द लेफ्ट साइड एंड ऑन द राइट साइड. इफ द रूट इज इनकम्प्लीट, if the root is incomplete, if the root is incomplete and pulp is present, pulp is absent. If the pulp is present, we apply some material here near the pulp which is exposed, which allows the pulp to function. पल्प का फंक्शन क्या है? द मेन फंक्शन ऑफ पल्प इज टू फॉर्म डेंटिन, विच अलाउज द पल्प टू डू इट्स नॉर्मल फंक्शन एंड अलाउ द रूट टू गेट कंप्लीटेड. दैट इज एपेक्सोजेनेसिस. That is apexogenesis. Here the pulp will be vital in apexogenesis. What is apexification? If the vitality test shows the pulp is gone, the tooth is non-vital, hopeless case, the pulp is not there, we apply some material here near the apex against which we do the obturation. So apexogenesis is basically allowing the normal tooth closure. Apexification is creating an artificial stop at the apex. हाँ, मैं YPT बोल रहा हूं. व्हाट इज यंग परमानेंट टूथ इज, मैं उस पर भी आ रहा हूं, ठीक है. सो आपने एपेक्स पे कुछ क्रिएट किया अगेंस्ट विच यू हैव डन द ऑब्जर्वेशन. व्हाट यू मीन बाय YPT, यंग परमानेंट टूथ? बेटा ये दिस इज यंग परमानेंट टूथ ओनली वेयर द रूट इज नॉट कंप्लीट. एनी परमानेंट टूथ विच इज इरप्टेड whose root is not complete is known as YPT or young permanent tooth. ये मैंने उसी के रिलेशन से बताया है. I have told you via that relation only. If the tooth is newly erupted but the apex is not formed and it undergoes some form of trauma and the pulp is there, then allowing the tooth to normal closure, that known as apexogenesis. The tooth is young, erupted, pulp is non-vital because the patient has came to you after 10-15 days or 2-3-4 months later. Then the pulp is gone. Then you cannot create an apex. You can just create an artificial stop here against which you are going to obturate. इसमें कुछ और भी डिटेल है. When you use calcium hydroxide, in rare cases there is some artificial stop. Radiographically you can see and all that. तो वो डिटेल है, मैं वो पढ़ाऊंगा तो 1 घंटा लग जाएगा मेरे को. Right? So that will skip to some class part, right? And the last question is, this was last question, ठीक है. But I have made 2 more questions. Let's cover them also. I have been told to discuss 10 questions. Let's discuss 2 more questions. Clinical situation of reversible pulpitis in which primary molar caries nearing pulp express sharp pain for short duration. That means कुछ खाने पे पेन होता है. That means the pulp is not involved. And if the pulp is not involved, ठीक है, पहले आप आंसर सोचो क्या है. It can be IPC. Then you see the options. Extractions नहीं करेंगे, pulp expose नहीं है, DPC नहीं करेंगे. RCT तब करेंगे when there is a spontaneous pain or there is abscess or sinus of fistula. Then the answer is IPT, indirect pulp therapy. Straightforward question है ना, डाल दिया आसान से. And this is the interesting question, last question. An 11-year-old kid reports with acute pain since last 2 days. Exfoliating primary first molar with periapical deficiency is seen in radiograph. What treatment would you do? ये इसका नहीं है, ये इसका पूछ रहा है. The question which is in orange. What will you do? Last question. What will be the answer? What will be the answer? Very simple. दिव्या, बच्चे की एज, पहली बात. सेकेंड थिंग इज, कैन यू सी एनी बोन between the tooth and the succedaneous tooth? There is no bone here, right? To give a space maintainer, two important thing: if there is bone covering, because for 1 mm of bone covering it takes around 4 to 6 months for the succedaneous tooth to pierce. Second, the chronology or succedaneous root completion. अब यहां पे succedaneous की रूट एक्सरे में नहीं है, बट एज तो है 11 साल का. 11 से 12 में आ जाता है. बोन है ही नहीं, निकालती वो आ जाएगा. ये भी आ जाएगा, ये भी आ जाएगा. सो जस्ट एक्सट्रैक्ट एंड सेंड द किड. If there is a MCQ which shows there is a bone covering, if they can say that the age is 11 years, there is a bone covering of 1 mm, then you can give space maintainer. But there should be some bone covering or the tooth has some time to erupt. Right? So this was basically a session to provide you some information which is not there in the current guidebooks. What can be the new type of MCQ which can be from. It's a way to show our teachers also, to interact with you also, all these things. I hope you have liked the session, and if you have liked the session and if some of your friends have not attended it, you can just copy the link and you can share it with your friends also, right? I wish you all success, happy studying, right? और स्टार्टिंग के जो हमने 10-15 मिनट बात की थी, आई एम रिपीटिंग इन हिंदी ऑल्सो, जो स्टार्टिंग के जो हमने 10-15 मिनट बात की थी, प्लीज वो अपने फ्रेंड्स को शेयर करना. सर, हाउ टू रिटेन ऑलमोस्ट एवरीथिंग 19 सब्जेक्ट्स? अरे, हाउ टू रिटेन 19 सब्जेक्ट्स? नॉट पॉसिबल शिवानी, इट इज इम्पॉसिबल. यू कैन नॉट रिटेन एवरीथिंग. आई कैन नॉट रिटेन इवन होल पीडो. गॉट इट? For success, you need to do less mistakes than your compatriots. आपके जो साथ वाले लोग हैं, आपको उनसे कम गलती करनी है. उसका एक ही तरीका है, करत करत अभ्यास होते जड़मति सुजान. मतलब टेस्ट देते रहो, रिवाइज करते रहो. आपको एग्जाम में 100% नहीं चाहिए. अगर आप 70% से ऊपर भी स्कोर कर रहे हो तो आप पहले 50 में रैंक आएगा आपका, राइट? तो 100% रिटेन कुछ नहीं होगा. जितनी ज्यादा मेहनत करोगे, जितनी ज्यादा प्रैक्टिस करोगे, उतना ज्यादा आपको रिटेन रहेगा. 100% रिटेन बेटा कभी नहीं रहेगा, कभी भी नहीं रहेगा. याद रखना ये चीज. तो उसके लिए पैनिक मत करना. बहुत एंजाइटी होती है, मुझे कुछ भी याद नहीं है ना. एग्जाम में सब याद आता है. जितना अभी आप काम करोगे, आपका सबकॉन्शियस माइंड जो 60, 70, 80% है, वो काम करेगा एग्जाम में. भरोसा रखो अपनी जबान है. ओके, आई विश यू ऑल सक्सेस, हैप्पी स्टडिंग. कोई दिक्कत है, कोई डाउट है, यू कैन फाइंड मी ऑन व्हाट्सएप ऑल्सो, यू कैन इनबॉक्स मी, राइट? ओके, फाइन. थैंक यू, गुड नाइट.